Janet, I'm 61, I'm from Liverpool. I was first diagnosed with primary breast cancer at the age of 39, just before my 40th birthday. So I had, my 40th birthday present was my hair falling out from chemo. So I had a lumpectomy, chemotherapy, radiotherapy, and then I had 5 years on tamoxifen. That was in 2003. So I think them days, the 5 years was the protocol. I think they've extended it now, haven't they? But anyway, I did that. And then 13 years, I was having mammograms every year. And then 13 years later, exactly 13 years later, in the May 2016, I was diagnosed with secondary breast cancer. So I had a mammogram and they found a tumour deep in my chest wall, right behind where I'd had the lumpectomy. And that was a met, and then then I had a PET scan and they found a met on my bone, on my hip.
Did you have any symptoms whatsoever?
I didn't have any symptoms, I thought at the time. No, I didn't know. But looking back, I was under an awful lot of stress. I was moving countries. I used to live in Hong Kong. I was moving countries. My in-laws were very ill. We were putting them in homes. My son was very ill. He had clinic depression. And I was extremely, extremely tired. I used to come home from work and couldn't get out of the car. I literally couldn't get out of the car. But looking back, I just thought I was stressed. But looking back, that was probably a symptom, but I just didn't connect that. I hadn't gone and thought, I just literally, I'd go to work and come home and just couldn't get out of the car. No, when I had my primary diagnosis, no, nobody said anything. And I truly believed once you'd passed the 5-year mark, which this magic 5-year mark everyone seems to talk about, I thought I was home dry. Yeah, totally. Misconceptions. Well, I think that people can live with it. I thought, initially, I thought myself, when I was diagnosed in the May, I thought myself I'd be dead by the December. I really did. So I think for anyone outside of having cancer would think exactly the same. I don't think people understand that you can live well. And there's more and more treatments out there. And I don't think anybody understands that. I'm still on my first line treatment, which I started in June 2016 on Letrozole and denazinumab injections. And then in the November 17, they introduced Palbo on the NHS. And then I was put on Palbo. So I've been on that and the other 2 drugs ever since, yeah. Which is nearly 9 years now. Well, I've go to a lot of the tea and chats, and I think online's great. And just I've got a lot. It sounds cheesy, and I don't mean it does sound very cheesy, but I have a great life. I've been married 35 years next month. I've got a great husband. I've got great children. I've got great friends. So besides this, I've got a very happy life. So I just try to be grateful for what I've got, really. So when I was first diagnosed with secondary, I had an operation to remove the lump in my chest. And then 6 months later, I had Sabra on my hip, which blasted away killed the tumour there in my hip. And then ever since then, I've been no evidence of active disease, which means there's no active disease that they can see on scans. But it's, sitting there somewhere, and it's the medication that's keeping it asleep. So, and I've been very, very lucky that I've been no evidence of active disease now for, that was the December 17, since December 17. Yeah, so they had the PET scan after that. I had the Sabra, and then since then it's been that way, yeah. I am extremely lucky. I'm at Guy's Hospital, Guy's Cancer Centre, and I have the most wonderfulest oncologist called Eleanor Sawyer. She's just lovely. and I have PET scans regularly, 4 to 5 months. I have done for the last all the years, and yeah, and I see her, and she gives me the results, and yeah, it's a wonderful. They're wonderful guys. I'm very, very lucky. I'd say forearm yourself, learn whatever you can learn, you know, find out about as much as you can, and join groups like this one that gives, there's always someone on that Facebook group, there's always someone that's got an answer, there's always someone that's been through something that you have that can help you out, give advice, because it's initially, especially if you're younger, I think initially it's very lonely. Because how many people you actually know out there that have got the same thing as you? You don't, do you? So I think finding these groups and finding people that can give you advice is great. Yeah. Well, I wanted to be involved in the campaign, I suppose, to promote secondary breast cancer, so people are more aware and everyone knows out there. I think when it comes to like Breast Cancer Awareness Month, it's just primary breast cancer, isn't it? And we only get one day. And I think people need to know that it does come back, and it can come back, and people need to be forewarned. And I can remember, I don't know whether I could say this, but my oncologist said to me one time, she said that room outside, my waiting room is full of people that have been misdiagnosed by their GPs. She said nobody's listened to them, and they've gone back and they've gone back and they've gone back. And she said, they could be in a far better place, but nobody listened to them. So I think it needs to be out there and needs to be known that it can come back, And it comes back in different places. Your bones and your aches and your pains can be a symptom.